Because you're going to take these outtakes, aren't you?
Of course.
How do you say it?
SIMIHAZE.
Is that it?
Yeah.
Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. And today we're going to go over the SIMIHAZE Twins. We get a lot of requests for this. They're Palestinian models, and they're kind of the new it girls in fashion and music. They're DJs and they're social influencers with millions of followers. And so a lot of people are asking about their transformations because they see their before pictures and their after pictures are pretty dramatically different. So we're going to take a minute and go through it and say, are these changes surgical, styling, what's going on with the twins? So the first place we're going to start is some of the most recent before and afters. There isn't a huge time difference in their photos, so maybe a couple years, 2 to 3 years. So when we see big changes in people in a couple years, we know it's not necessarily related to aging and different things, that something's probably going on there. But also, like I always say with people that are in the media and the limelight, there's also different changes that can look like surgery. So in their case, we see big changes in their fashion, in their hairstyling, their makeup, their clothing. And so all of those things already are going to make a dramatic change in their appearance. So we can see that those changes in them are obviously going to be masking some of the surgical changes. But right off the bat, we can see dramatic changes in all their styling and hair. Like I said, hair, clothing, makeup, everything's different. And so that's going to make them appear like they did things. Now, did they do things? I think so. So now we're going to take a look at them and say, what else could they have done surgically to alter their appearance? So first thing we're looking at with the twins is the cornerstone of the face, or one of the most distinguishing features is, of course, the nose. And I see some definite changes in the nose. So I think there was a rhinoplasty performed on both of them. And it's interesting because in twins, I do surgeries on twins, and sometimes the twins want to look more alike, sometimes they want to look less alike. And I think in this case, the noses do appear a little different, but they also did get a similar rhinoplasty. And I think it was done well. The nose obviously went from being more bulbous and stronger and more masculine to much more aesthetically pleasing, more feminine. The bridge is narrowed, the hanging columella is corrected, the tip is brought in and more defined. So for sure, rhinoplasty was performed on them. So now let's look at the rest of the surrounding face. So if we look at their cheeks and their mid-face, and just overall, they looked a little bit more full in the face to a little bit more contoured heart-shaped face later on. Now typically that could be done to weight loss, but we don't see a huge weight change in them, and then also aging, and there's not a big age difference. So what could do that? One of the most common things is when you're flipping the face is to subtract from the lower face, which is called a buccal lipectomy, which can bring in the lower face, and then also adding to the upper face. So there may be some facial fillers, some cheek highlights, again giving that appearance of a more contoured face. I do also notice in the jawline that the jawline looks also a little more defined. And there are some simple things to do that. Sometimes even a little bit of Kybella, which is an enzyme that dissolves fat, or some liposuction in the neck to contour and give that jawline more definition. It's possible, but it could also be, again, with contouring with makeup, lighting, everything else that's going on. So there are some little tricks there, but I do see some of those changes in their face where they went from these more kind of adolescent, less defined faces to these more mature, elegant, contoured faces. So one other area you want to look at is the eyes. We do notice that there is some reshaping of the brows, maybe some microblading, some different styling in the brows. And again, all of that's going to bring out the eyes a little bit more. I think also if we look at the upper eyelid, there's more openness to the eyes. So it's a possibility of something called the upper blepharoplasty where that skin's removed to open the eyes a little bit. I don't think anything was done as far as necessary brow lifting or threading, and also sometimes just a touch of Botox in that area will open up the eyes a little bit. So it could be a combination of those different things, and of course their styling, the way they're wearing their eye makeup, all these things can change that appearance. And then lastly, we notice their eye color. This seems like they're playing with colored contacts and trying to bring out their eyes with different colors for more dramatic effect. So I think overall there's definitely those surgical changes, again, along with all these other things as far as non-surgical changes that are adding up to this more dramatic change in their appearance. I think in summary, the twins are a good example of how a combination of changes in styling along with surgery can add up to a very dramatic change in appearance. So if we're looking at their bodies, we notice there isn't a huge change in weight or other things. So that didn't affect their appearance. Something else was going on. Like I said, changing their features to balance them out, bringing in and contouring the nose, the cheeks, the lips, all of these, they definitely have little fillers in the lips. All of these things start to bring out certain features to make them appear more attractive and more feminine, as well as then the styling, changing the hairstyle, changing the makeup, changing their wardrobe. The results are that they're more attractive. That's what we want out of surgery and hairstyling and changes, that it wasn't done too extreme, it was done well, they appear very natural, but they also appear more attractive.
So I know that you've operated on twins before because I saw it on Dr. 90210. And I think you reacted to a twin video that you, an episode of Celebrities Under the Knife for Dr. 90210. But seeing as though you have done surgery on twins, do you find it more difficult if they want to stay identical? Is that tricky?
I think it's more challenging in some respects to make them look more identical, but it just depends where we're starting from. Sometimes the twins, it's interesting, even though they're identical, their features can be quite different, you know, from an epigenetic standpoint. Maybe something happened as they were maturing or growing. But I think overall, as long as, like when I did those twins, one of their noses was really crooked and one was really straight, so it made it more challenging to make them more alike, but also it was a more dramatic change because they were so different. Now, when they start out really similar, it's a little easier to make them stay similar. It would be more interesting if they wanted to look a lot different. That would be even more interesting, but I'd say most of the time, they want to look more alike or stay, you know, looking somewhat alike.
You know, with, I guess, identical twins, could their buccal fat pads differ at all, or like their submental area differ at all?
Yeah, I think even in their case, you know, if you look at them, they have slightly different features, right? I do think the nose is one of those surgeries where you could give somebody 10 different noses, right? Or 10 different surgeons might give people 10 different noses. So I think that the nose is very customizable, and the features of it can be, you know, changed. The tip, the bridge, they can come out. You know, there's a lot of factors that go into that nose. Whereas if you're taking out buccal fat pads or neck lipo, you're just taking out what's there, right? But there are definitely asymmetries in those areas in twins as well. The buccals can be slightly different. One twin can have bigger buccals, one not. So there's definitely differences in the twins in all areas of the face, but those tend to be a little bit less variables there, so you're just going to bring it in, you know, similar in both of them.
Last question is, if you are a twin that's seeking rhinoplasty surgery, should you look for a surgeon who's previously operated on twins?
You know, any well-trained, experienced rhinoplasty surgeon should be able to do surgery on twins, you know, whether they want to look more or less alike. But you do see even in nature that, you know, twins aren't perfectly symmetric. Nobody's perfectly symmetric. Nobody's perfectly identical. But I think certainly in any skilled hands, you know, you should be able to give the twins what they want, whether they want to look more alike or less alike. It's slightly more challenging, but also slightly more fun. So I think, again, if they go somewhere where they're experienced, they should be able to get the results they want.